Stage 4 cancer is grim, but it's not the end. Good morning. It's Tuesday, March 21st. I'm Jessica Lovell, and welcome to the Morning Medical Update. Today, we meet a survivor who got diagnosed at a surprisingly young age. She's part of a concerning trend in colorectal cancer cases. First, though, before we get to that, let's get to our morning rounds. We are highlighting a disorder that causes pelvic pain and impacts at least 10% of all women. Endometriosis impacts millions, and many struggle just to get it diagnosed correctly, not to mention getting the proper treatment. Dr. Austin Findley is joining us. He specializes in endometriosis. He is the director of minimally invasive gynecologic surgery here at the health system. Good morning. How are you?
Good morning, Jessica. I'm well. Thank you very much for having me this morning.
Yes.
I appreciate the opportunity to highlight this important subject.
Well, and I'm glad you're here because I think I've lost count of how many friends and women I've heard who have endometriosis. So just tell us what that is and what symptoms does it present?
So endometriosis is a chronic inflammatory disease that is characterized by the presence of endometrial-like tissue that exists outside of the uterus. So the endometrium is the lining of the uterus that is sloughed off during menstruation, and when this same type of tissue implants itself outside of the uterus in other locations, such as the fallopian tubes, ovaries, the bowels, the bladder, that is what endometriosis is. And it can also exist in more distant sites, such as the diaphragm and lungs as well.
So it's obviously it's pretty common because we hear about it a lot. Why is it so hard to get diagnosed?
Well, it's hard to get diagnosed because there's still so much that we don't know about the disease, including how and why some people even develop the disease. And the symptoms are highly variable. They can range from very mild in severity to severe, and they include pain with periods, pain with intercourse, pain with urination or bowel movements, but sometimes more vague symptoms such as fatigue, bloating, nausea. And so there's no one symptom that fully explains the disease. And additionally, it's not something that often shows up on imaging or even physical exam when we're evaluating patients. So it makes it very challenging to establish a diagnosis.
But once you are diagnosed, what's the best way to treat it?
So this is something that I really want to highlight that we do differently at KU. I think the best way that we can treat endometriosis is with good surgical treatment. So this involves complete surgical excision of disease. So the way that I try to approach this condition is basically treating it like a cancer. We want to remove all visible disease while respecting the patient's reproductive goals.
So any advice for patients who are struggling to get that diagnosis? What should they do?
So at the University of Kansas, we have specialists such as myself who focus on this disease, and we should have a high index of suspicion for patients who present with these types of symptoms, because on average our patients go nearly a decade with symptoms before they receive a definitive diagnosis. So that's something, the most important thing that we do is listen to our patients and work with them to establish a diagnosis. And that's something that we can offer that we do very well here at the University of Kansas.
All right, Dr. Findley, we're going to have you back on, do a whole show about this.
Okay.
Does that sound good?
That sounds good.
All right, thanks so much for being with us this morning. Joining me now here in the Dulcie Simons Jr. Family Broadcast Studio are Dr. Deepika Agarwal and Dr. Anup Kasi. Good morning to both of you.
Good morning.
Good to see you both. Dr. Agarwal happens to be a neurologist here at the health system, but today we are talking to you as a cancer patient and a cancer survivor. Dr. Kasi is a medical oncologist at the University of Kansas Cancer Center who was part of the team that treated Deepika's cancer. So good morning to you, Dr. Kasi.
Morning.
Good to have you. The newest numbers from the American Cancer Society show colorectal cancer rates are dropping for a large section of the population, but not for people younger than 50. This 20-year chart you're seeing here shows a serious drop in cases for people aged 65 and older, but as cases drop for that group of people, cases are creeping up for adults under the age of 50. So, Dr. Kasi, why are CRC rates going up for younger people? This has been kind of a mystery.
Yeah, that's a very good question. It is a mystery and a disturbing trend that we're seeing. It's kind of becoming a common cancer in an uncommon age, if you will. And the reasons for that, I think, is multifactorial. There are several reasons, but the big ones are lifestyle and diet. Obesity, sedentary lifestyle, that's a risk factor associated with several cancers, including colorectal cancers, as well as red meat, low fiber diet is linked to colorectal cancer. The other reason, possible reason, may be that we're not screening these patients at the younger population because you're not suspecting cancer, and so these patients may go undetected and may present with a full-blown cancer. The other big reason I would say is genetic and environmental factors, which is hereditary risk factors such as Lynch syndrome, and that is associated with cancer in younger population.
So Deepika, you were diagnosed 5 years ago, just 36 years old. As far as lifestyle goes, you had a very healthy lifestyle. You said you're vegetarian, you exercise, you were getting regular screenings as far as your health went across the board. You're also a physician, so we assume you're doing all the right things, but we know that doctors can be patients too. But what were you feeling right before you were diagnosed?
So, well, my symptoms are, I did not had any major symptoms for a long time. My symptoms were a few drops of blood in stools for on and off for maybe 2 or 3 months, which I blamed on hemorrhoids or fissures because of chronic constipation, which in hindsight now I've been dealing with chronic constipation for maybe a year or 2 before the diagnosis. But then later on I developed some abdominal discomfort, which led me to see a gastroenterologist, and then they ordered a colonoscopy.
Wow. Okay. So now you're starting down the trail, Dr. Kasi. That's one of the tricky things, though, about colorectal cancer, as Deepika was saying, because people may have these symptoms, but then chalk them up to something else. How does someone decide if they should see a doctor and when to see a doctor?
Yeah, that's a good question again. I think, in the younger population, we don't suspect that even as primary care physicians. That's not on our radar to start with. But I think paying attention to your body, if you do notice acute changes in the bowel habits, change in the caliber of the stools, blood in stools, those are red flags. If you do have non-specific symptoms such as chronic constipation, like what Deepika had, or fatigue, or some other constitutional symptoms, then it's good to discuss with your primary care physician. They may order labs and see if you're anemic. Then that's another red flag that there could be something serious, such as colorectal cancer.
Deepika, did you have any family history that you were aware of?
No, I didn't had any family history of any kind of cancer.
And you're a woman in your 30s. You're just not thinking of this, right?
No, yes.
Okay, in full disclosure, you two are colleagues, but you were friends first, right? Tell us about that and how you felt comfortable going to Dr. Kasi.
So yes, we were colleagues, and we did our internship together. So I still remember when my gastroenterologist, Dr. Findley, when she told me the colonoscopy results, and she said that you need to see Dr. Kasi. My first thing was like, Anu, no, he's an oncologist. He's my friend.
Right.
But, yes, but then in the evening we talked and had a phone call with Anup, and
yeah, you said you two got together as friends because
Yes.
this is not an easy topic to talk
Yes.
about, but you needed to go full throttle and really get down to what we were talking about. You have this colonoscopy, and I want to show some photos and just let everyone know we are talking about colorectal cancer and a colonoscopy today. We're going to show viewers, if you're just a hint squeamish, you might want to just look away for a moment. Dr. Kasi, we want to show what you saw after this colonoscopy was performed. Could you tell this was instantly was stage 4 cancer?
Yeah, well, I mean, you cannot say for sure it's stage 4, but we certainly know that it is cancer in the rectum or the colon with this large fungating type of mass.
What is all that?
Yeah, I mean, all of that is the cancerous tissue. It's developed into this mass that is partially obstructing, fungating. There are areas of bleeding as well. So this is what a gastroenterologist would see when they do a colonoscopy, which makes them very suspicious that this is cancer.
We want to show photos after the treatment. Very obvious in that difference. So what was the treatment and what are we seeing here?
Yeah, this is after surgery, basically. That is undergoing preoperative treatment with radiation, chemotherapy, and then Deepika underwent surgery where the cancer was cut out. So we're seeing the area of anastomosis where the remaining healthy colon has been rejoined.
You said you had never seen those photos before.
no, I did not.
What do you think?
Well, they look bad and concerning.
Very concerning, very interesting before and after. Tell me more about your treatment, though. You did start with chemo, correct?
So actually, my treatment started with 5 days of high-dose radiation.
Okay.
And then that was followed with 4 cycles of chemo. And then after that was an extensive open abdominal surgery that included HIPEC, then removal of the primary cancer and various organs where the cancer had spread, and then creating an ostomy.
All right, let's talk HIPEC. Explain what that is to folks.
Yeah, sure. So HIPEC stands for hyperthermic intraperitoneal chemotherapy. So this is a specialized treatment that's done only at a handful of centers, such as University of Kansas Cancer Center.
And we have video of this happening right now. Very interesting.
Yeah, exactly. Basically the surgeon opens up the abdomen, cuts out all the tumors, including the nodules that they find, studying the lining of the abdomen called the peritoneum, scrapes all of that out, and then the cells that cannot be seen in the operating table with the eye of the surgeon, that's treated where we heat up the chemotherapy and then infuse that into the abdominal cavity. So the heat helps the chemo penetrate better and take care of those cells, microscopic cells, which cannot be seen otherwise, and that way you get rid of the cancer.
And what's that moving around the belly?
Yeah, so they move the belly around so that the chemo that they install into the abdominal cavity is distributed well to all areas within the abdominal cavity or the peritoneum, so that all areas are effectively treated with the HIPEC.
So how are you doing today?
Doing good, cancer-free, and healthy, and
that's what we like to hear. Big thumbs up from your doctor. I want to show the moment where a photo here where you rang the bell. This is the moment every cancer patient turned survivor wants to be a part of. What do you remember from that day?
Oh, that was one day I was very excited for the day. Obviously, that was the end for the cancer treatment. So yes, it was, and it is still a memorable day.
It really is. Never get tired of hearing that bell ring around these halls,
No.
that's for sure. And since then, you've become an advocate. Why has it been so important for you to share your story and be out in the community?
So, well, my goal is to help in raising awareness for this, because of the same fact that you mentioned earlier, that the rates of colorectal cancer are increasing in young people. So in fact, March is the Colorectal Awareness Month, so thank you for inviting me. And I would like to use this platform as a measure to raise awareness and serve a reminder to anyone who is above age 45 or older, or have a family history of colorectal cancer, or have any kind of GI symptoms. Get screened, get checked out. And for those who worry about the preparation for colonoscopy, believe me, it's nothing in front of the chemo, radiation, and surgery. And of course, it's nothing in front of the emotional, physical, mental turmoil the diagnosis of cancer brings with it.
I'm so glad you bring that up, because when we talk colonoscopy, people always talk about the prep, Dr. Kasi, and yes, it's not pleasant, but it's necessary, right?
Yes.
Exactly. Yeah, it's a preventable cancer. You get a colonoscopy done, and if there's a polyp that is a precancerous lesion, you can cut it out and prevent that from developing into a full-blown cancer.
Okay, we have a few fun pictures of you, Deepika. You wanted to be a doctor at a very young age. We're looking at some photos now, and as we've been talking, doctors can be patients too. It's just something to remember. This is you in school, and then you make it to graduation. And I think we have one of your folks. This was when you were in India visiting your parents before you were diagnosed with cancer.
Yes.
How has it been having your folks farther away and not having them close by to lean on?
So no, my folks were here, or my parents, they traveled. They came here during my cancer treatment. And then, of course, they went back once I was cancer-free and was back to work. But then they had to come back again.
Because?
Because unfortunately, after my cancer, I had a stroke. So that left me aphasic or with speech difficulties and completely weak or hemiplegic on the right side of my body.
And I know we have some photos when you were going through rehab after this stroke, but I'm curious, Dr. Kasi, is that something connected? Can it be connected?
I mean, not necessarily. It's not typical to find that. Being on chemotherapy or anti-cancer treatments may sometimes increase the risk of clotting and bleeding that could happen, but she was far out from her treatments. So it's probably a different cause.
Different cause. So you all right, we don't have those photos, but so what has this been like for you? How have you managed to get through this? I mean, you're so young, a stroke, cancer survivor, physician out in the community. What's this been like for you?
So it is definitely an eye-opener, and it has made me much more, it has just made me a different person now. I mean, being a physician, it's still there, of course, but it has just changed the way I practice medicine.
I bet.
The way I can relate to patients now, it's just completely different.
If you have questions about colorectal cancer for Deepika or Dr. Kasi, make sure you get those sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to all of those right there on your screen. Let's get a quick check of our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. Happy Tuesday.
Hi, yeah. Happy Tuesday. Good. Good. Right now for cases here in the health system, we have 45 total. 29 of those are active, so down a little bit. Still 7 in the ICU and 2 on the ventilator, though. So numbers are holding steady. Hopefully what we've been seeing the last couple weeks is that those numbers do dip later in the week as well for those active cases.
All right, Doc Hawk, spring has officially started. We like the sound of that, but that also means tick season is right around the corner.
Yeah.
Most tick bites, they're pretty harmless, but you still see patients with tick-borne illnesses. What should people be aware of right now?
Yeah, so I think it's important. Again, we were talking about prevention here with cancer. It's also, prevention is also important for tick bites and things of that nature. So just understand where you're going. Obviously, there are CDC recommendations for things to help reduce the chance of getting bit by ticks or getting them on your body where they take their meal, and that is when the diseases are spread. So prevention is the best. Wear light-colored clothes, either white or light khaki, so you can easily see them. If you are out when you come home, do tick checks. But of course, always wear insecticide with DEET. That is probably the best. There are a couple other things out there as well that you can use, but preventing the ticks from being on is always most important as well. We know that they can transmit several diseases. We don't have much Lyme disease around here, although people are really focused on Lyme disease. We really don't have a lot of Lyme disease in this area, despite having we have some of the ticks that can carry Lyme. We have other diseases which are much more common. These are all bacterial infections, things such as ehrlichiosis and Rocky Mountain spotted fever. There's also babesiosis. We have a little bit of that. That is also more prevalent up in the Northeast where Lyme is prevalent as well. The treatment is easy. It is, for most of these, it is very easy to administer. It's a generic drug. But just the most important thing is to be careful as we are getting out in the warmer weather now. We haven't had as much cold weather and those hard freezes, which really helps to reduce the tick population. So prevention, understand where you're going, wear light-colored clothes, wear insecticide with DEET to help prevent those ticks on. And then if you have a concern, please just contact your physicians or your medical team.
All right, Doc Hawk, thank you so much. Any reporters with us today? Let's get to our community questions. Dr. Kasi, do you think people under the age of 45 should be trying to get a colonoscopy? How does someone get that if maybe they have that family history or just are concerned?
Yes, it depends on your symptoms. That would be something you would discuss with your primary care physician. If there's a strong family history or a known genetic risk factors, proven genetic syndrome, then yes, they do qualify for colonoscopies at an earlier age. If their symptoms are such that it's a red flag, like what we discussed before, blood in stools, acute change in the stool caliber or the bowel habits, the constipation. So those are also, again, risk factors that you would discuss with your primary care physician. And if there's no other common causes that could cause this, then you should consider getting a colonoscopy.
Lynn wants to know, is a colonoscopy covered by insurance if you're under that age?
Yes. I mean, if it is medically indicated, if you do have a reason to get a colonoscopy, a diagnostic colonoscopy, then it would be covered by insurance. So that's a diagnostic colonoscopy. Whereas a screening colonoscopy is for patients or people who are average risk, who do not have symptoms. So that's a different procedure, if you will, a screening colonoscopy. A diagnostic colonoscopy should be covered by insurance.
So that's anyone 45 and older, correct? 45?
Screening would be 45 and older.
Okay. A question from Susan is, how do we help kick the colon stigma? Being able to talk about it the way we were talking about it earlier and feeling comfortable sharing this, especially as we see these statistics in younger people. I would like to hear from both of you on that.
Yeah, go ahead, do you want?
So yes, I mean, it is, I think you feel shy about telling that, yes, I have a rectal cancer or where the tumor is located. But hey, it's still our body. Mm-hmm. I mean, it's a part of your body. So, I mean, how can it be different? I mean, how can it be different from I have a brain tumor or a rectal cancer?
It shouldn't be.
It shouldn't be.
Dr. Costi, your thoughts?
I mean, I agree. I echo the same words, and you can call it something else if it makes you feel better. You can call it gut cancer, or if you don't want to use the word rectum or anal canal, you can call it something else. But
I think we should just call it what it is.
Yeah.
Right.
Yes.
Yeah. Certainly.
Yes,
I mean, that's
true.
It's just that people need to get used to it.
Yeah. And I think we are. Yeah, we've gotten used to saying it around here a lot. So, so we appreciate you sharing your story. How long were you out of work? Jerry wants to know, how long did you have to stay away from your patients?
So for the cancer, during the cancer time, I was off work for entire 9 months. And one thing is, I mean, my employer, I mean, KU, I mean, they are very cooperative. My entire department, they just treated me like their own child, own kid, so they were really very supportive. So I stayed off work for 9 months during my cancer treatment.
Yeah, they're pretty good like that around here, aren't they?
Yes.
What was the worst part or the hardest part of the treatment? You went through so much, including that stroke afterwards. What was just the hardest part of all of it?
Well, I think everything was hard. Mm-hmm. I mean, seeing the physical changes on your body. I mean, with the chemo, with the cancer treatment, you lose all your hair. You start looking different. And then I mean, just you look different. And then, of course, there are so many medical changes in your body. It causes. Again, there is a lot of mental, emotional turmoil because of the cancer diagnosis and the treatment. So, yeah, I mean, and then of course, I mean, life goes on.
You doing good?
Yes.
I like to hear that.
Yes.
We like to hear that. So Jeremy has a question. Was there anything you understood differently about colorectal cancer after experiencing it firsthand? Maybe what you had thought about it before, read about it before as a physician, but then you go through it. What did you discover?
Oh, I discovered lots and lots. So, of course, what I had read about colorectal cancer before, it was just as a neurologist and maybe just reading superficially, not like Dr. Kasi, who's an oncologist. And then after experiencing it, I mean, I have experienced it firsthand on my own body. I have taken the chemotherapy, I have had the surgery, everything on my own body. It's the first-hand experience.
It's changed you completely as a person, a woman, and as a doctor.
Yes.
Last question from Ursula was about just your support. And it's nice to have doctors as friends and friends as doctors. I know Dr. Kasi was a support as a physician and a friend, but what was that like, and how important, if you were speaking to people who are friends with somebody recently diagnosed, what would you say to them about being there for them?
So, yes, so that's a very good question. And I am a strong promoter for emotional health and emotional support system. So definitely, if you are fighting through any chronic disease, let's say be it cancer, be it a stroke survivor, or any other chronic medical condition, it brings with it a lot of emotional challenges and emotional turbulence. So definitely that's what I tell everybody, and my patients also, that don't shy from asking for help. That help can be provided by your family, by a therapist, a counselor. Don't feel shy for talking to your primary care or any doctor that yes, I need help. Medicines, there are therapists, there is meditation, mindfulness. There are so many things that you can do. Join a support group, but do not encapsulate that emotional challenges in yourself, because fighting the emotional challenge is the most important thing, because I mean, that helps you to fight the rest of the challenges.
So many great messages here today and such an important topic. Let's get to today's takeaway. Dr. Kasi, what do you want us to know?
Yeah, I mean, with the disturbing trend that you showed with the rise in colorectal cancers in the younger population, so I would say, you know, it's a preventable cancer, a curable cancer, and a treatable cancer. So pay attention to your symptoms, your body, and get your screening colonoscopy at age 45 or older.
Deepika, thank you so much for being here, not as a doctor today, but as a patient, and sharing your story and just being so open. We appreciate you. Final takeaway today.
The same, if you are 45 or older or have a family history of colorectal cancer or any GI symptoms, get yourself checked and get screening done.
Dr. Hawkinson, final takeaway.
Yeah, I mean, I think it's still prevention. You know, obviously we talked about ticks. Prevention is the best thing to do. If you can prevent tick bites, prevent cancer, get your screening, get your preventive screenings, whatever that may be. We know there are several of them, including mammograms and colonoscopies, of course. But I think if we take that extra step to do that prevention, it will pay off in the future.
Absolutely. Thank you so much. Well, ahead of the Royals home opener next Thursday, we asked the team's medical director and head physician to give advice for younger players. Here's Dr. Vincent Key's tip of the day.
This is Dr. Vincent Key, head team physician for the Kansas City Royals, with your tip of the day. The tip of the day is running. And that's something I know very well, being a former track athlete at Kansas State, is being able to get your body ready to run. And that's what a lot of people, especially in baseball, don't understand in terms of getting their bodies ready. You have to stretch every single day, getting your hamstrings ready, getting your quads ready, getting your hip flexors ready, getting your glutes ready, getting them strong. And those are the things that A, you do in the weight room, and B, you can just do on a regular mat at home. There are some myths that I need to kind of break. When you're hitting and you're running to first base, a lot of people like to lunge. And lunging actually slows you down. It doesn't necessarily speed you up. So you would be better served running through the base like a sprinter instead of either sliding or lunging at the bag. And lunging at the bag most of the time will get you injured because you're lunging and you're doing what's called a deceleration, trying to slow yourself down at the time that you hit the ground from lunging. And that can definitely increase your risk of injury. And that's your tip of the day.
And before we go, we want to mention the new option for patients on the south side of the Kansas City area. Health system leaders. Health system leaders cut the ribbon on a brand new clinic space. It's in the Corbin Park retail area near 135th and Metcalf. Patients can see their primary care provider as well as a pharmacist and nutritionist, therapist, and much more. The president and CEO of the Overland Park Chamber of Commerce says the clinic makes the entire area just more attractive.
This is a very growing part of our community, both for residents and for businesses. And so, that's a really important factor when someone is looking at either moving to the community or for businesses who are looking at locating, because of course they want to have rapid access for their workforce.
The first patients are scheduled for this coming Monday. Everyone, have a great day. We'll see you back here tomorrow at 8. Early in the COVID pandemic, health and community leaders had to make emergency decisions, including stay-at-home orders. I'm Jessica Lovell on the next Open Mics with Dr. Stites. We look back to learn more about those choices in the early days and how they are still impacting the state of things today. Wednesday at 8.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.